Please know that I am not a medical professional, so do not use this video to self-diagnose. This is for educational purposes only. Thank you. Strokes are the second leading cause of death worldwide and the fifth most common in the United States. Every minute counts when a patient is having a medical emergency. But what are strokes? Strokes are either a blockage or a hemorrhage of the brain. They damage the brain's cells and tissues. They need to be treated quickly. There are two different types of strokes, ischemic and hemorrhagic. Ischemic strokes happen when blood supply to part of the brain is blocked or reduced. This prevents the brain tissues from getting oxygen and nutrients, which causes brain cells to die in minutes. It's crucial that this is caught quickly so it doesn't spread. Hemorrhagic strokes happen when a blood vessel in the brain leaks or bursts, causing bleeding in the brain. The extraneous bleeding causes pressure to be applied to the brain cells and damages them. What symptoms should we look for? Trouble speaking or complete loss of speech, blurry vision, confusion, dizziness, vertigo, headaches that are sudden and severe, loss of muscle control on one side of the face, loss of coordination, memory loss, mood swings, nausea, vomiting, neck stiffness, fainting, and seizures. BFAST is an acronym that we can remember when we think a stroke might occur. Balance. Watch to determine if they lose their balance suddenly. Eyes. Are they seeing double, lose their vision, or did a change happen in one or both of their eyes? Face. Look at their smile. Is their mouth drooping on one side? Arms. Have them raise both of their arms in front of them and have them close their eyes. Is one of the arms starting to drop? Speech. Are they slurring their words? Are they unable to form coherent sentences? Time. Call emergency services as soon as signs of a possible stroke occurs. What medications and treatments help with these types of strokes? For ischemic strokes, medications called tissue plasminogen activators break up blood clots that block blood to the brain. They must be administered within 3 hours after the stroke symptoms start. If not administered in those 3 hours, it could risk severe damage to the brain tissue. Anticoagulants or blood thinning medications can be started to help stop the blood from clotting. For hemorrhagic stroke, blood pressure medication will be started to maintain equilibrium of the pressure in the brain, so that pressure doesn't kill the brain cells. If the patient is taking anticoagulants or blood thinners, they will be taken off of them so the bleeding in the brain slows or stops. What does the recovery from a stroke look like? Patients may need to adjust their lifestyle after having a stroke by maintaining a heart-healthy diet, like eating fruits, vegetables, whole grains, fish, poultry, and nuts. Some strokes can relapse because of stress, so patients will need to manage their stressors. They need to get into the habit of regular physical activity in their routines. Some patients may need to stop smoking if they are, as well as get enough quality sleep. They also need to speak with their healthcare provider to get proper care after the stroke because some of them might develop problems after, like loss of control of their bladder and bowel. They might also experience loss of their memory and or changes in the way they speak languages. They might also develop muscle or nerve pain. Some patients might have difficulty swallowing or eating foods that they are used to. Depending on the type of stroke, there may be a surgery for them to help prevent strokes from reoccurring. Why is this information important for pharmacy technicians or other medical professionals? Knowing the signs, no matter where a patient might be, can only be a benefit for them. Strokes can happen anywhere, at any time, so it's important to be alert and aware of what might happen. We work together as a patient's care team. Being able to answer their questions or lead them in the right direction to get answers about their treatment can help them recover smoothly. It helps them get to be as close to their normal as they were. Strokes are a medical emergency that need to be addressed in a timely manner, so patients don't suffer the damage to their brain or even death. So, I hope this helps everyone keep an eye out for their fellow humans, creating a safer place out there for everyone. Thank you for watching. Let's keep everyone out there safe and healthy.